My job role is basically going out to patients' houses, patients who are housebound who can't get to a GP service or a practice, and carrying out care in their homes basically. I've done this for 10 years in total, and basically our practice has changed quite a lot during the pandemic. We still worked through, we carried on doing our usual day-to-day care, as none of it can really be, it's all essential, but it was a lot more time consuming, a lot more donning and doffing of PPE, a lot more phone calls and prep work before we went in to see patients to check for symptoms, check for family members who had any symptoms, and obviously trying to kind of make sure that our team remained safe and look for any people who might have been at risk and try and navigate who could go in and see who, which is not something, I mean, we usually do it, but it was from to a much greater extent during the pandemic. There was a lot more apprehension early doors when sort of COVID was first out and about, because obviously it was a bit of an unknown. The hospital's quite a controlled environment. There's always staff there, there's always someone there to kind of ask advice from, get information from, but because we're very much lone workers, we were basically out by ourselves, and you don't know what you're going to go into on a day-to-day basis, which is usual, but particularly throughout this, you don't know who's going to be in the house, where they've been, who they've come in contact with, what family members are there, what symptoms you might come up with, and particularly in the early days when testing wasn't as widespread as it is now, not really many of our clients had really been tested, so we didn't know if anyone was positive, negative, or what really. So it did increase anxiety, and particularly when all the PPE regulations and things came in, I think people were quite concerned about making sure they were doing it properly, where we were going to get rid of PPE, how we were going to put it on, when we were going to put it on, when was appropriate, when we could hand wash, when we couldn't, usual sort of things that tend to come up in community visits were just kind of amplified, I think, more by all the new regulations and PPE and stuff that we had to wear. The patients and the clients have actually, they've been really understanding. There was a period where we would sort of ring ahead of time if it was something. We've got quite a few visits and quite a few clients that we see kind of annually or biannually or sort of a couple of times a year that didn't necessarily need to be seen at a particular time. So we'd liaise with them, and most people were really understanding of what was happening and kind of didn't want us in their house, but we're quite happy for stuff to be delayed to a couple of weeks later, a little bit further down the line where needs be. I think for us in the team, it's been a new way of working. We've had to incorporate quite a few different ways of keeping in touch with the social distancing and everything. Usually most of us would come into the office on a morning, we would collect and stop, have a bit of a handover, pick up our lists, go out, come back at lunchtime, have a face-to-face handover. So we'd be in contact with each other face-to-face quite a lot. But obviously we're trying to limit the amount of people in the office, limit our sort of contact with each other. So we've had to utilise Teams a lot more online handovers, working out from our cars, working from different bases. So there's been a lot of adaptation really.
It's been a really interesting last few months, and we've had to completely redesign our service to meet the needs of patients during this time. Our manager was fantastic because we're based in the community, and it's really important that we stayed in the community because most of the patients with COVID are out in the community and their families. So we looked at our service and thought, how best can we meet their needs? And what we did was to prioritise who needed to be seen at home, and changed a lot of what we're doing to telephone contacts. So we ran lots of telephone clinics. We were a hotline for anybody who had any concerns, and that looked very different because we thought there'd be a lot of physical concerns, and actually there were a lot of psychological concerns. Patients were very anxious about COVID, and there was a lot of bereavement as well. So it was quite an interesting time for us. So patients with heart failure who are referred to us, that could be from the GP, that could be from the outpatient department, self-referrals, we will see them, we will devise a management plan for them, we will optimise medication, help them get their head round what's going on, but more importantly as well, we try and enable them to manage their condition themselves, which reduces the chance of them becoming unwell and helps them recognise really quickly if they're becoming more symptomatic with their heart failure. So hopefully we can prevent admissions for them. We run lots of telephone clinics now so that people have got access to us very quickly during the day. But what happened was that patients seem to become even more adept at looking after themselves. We've enabled them to become more independent, which is actually quite good. So we've learned a lot from the pandemic, that we don't have to see lots of patients every day in clinics or at home. We can actually use more telephone services and be there for the more acutely unwell patients. So it's actually been a learning time as well as quite a challenge. Most patients have been very understanding. What we didn't realise was just what a psychological impact the pandemic was going to have on our patients. In the start, lots of people died, lots of relatives died, and patients were locked down, isolated and desperately lonely. So the fact that we could visit wearing PPE was really important to them, and we spent a huge amount of time on the phone listening to patients and trying to get a feel of how life was for them. So yeah, it's been a difficult time for many people. It's yeah, you realise that people matter hugely and that people are really going through it, and Sally and I have worked really hard together, and I think we're coming out the other side now. But yeah, it's a few months we won't forget, and of course we're not through it yet, so hopefully it'll be okay.